Welcome back all of you to Mock Test Explanation Series Part 21 for Government Nursing Officer Exams. The first question. A patient with severe uncontrolled epistaxis, BP and platelets counts are normal. To minimize occurrence of bleeding episodes, the nurse should teach the patient to Option 1. Sleep with head elevated. Option 2. Apply pressure to nostrils 4 times a day. Option 3. Apply a water-soluble lubricant to nasal septum twice daily. And the fourth option is to minimize the intake of caffeine and increase fluid intake. Let us go to the right answer. The right answer here is Option 3. Apply a water-soluble lubricant to nasal septum twice daily. Epistaxis. It is the bleeding from nose. Dose. What we supposed to do for epistaxis is humidify the air, keeping the nasal passage moist. Then apply saline nasal sprays or water-soluble lubricant to prevent friction. Don'ts are avoid forceful blowing and no pricking or rubbing of that area. So here, sleep with head elevated is not the correct option. Apply pressure to nostrils 4 times a day is not a solution. When the bleeding comes, that time you have to start to giving pressure for some time, but otherwise for preventive purpose, there is no point in applying pressure. Apply a water-soluble lubricant to nasal septums twice daily will moisture or lubricate the nasal area. Then minimize the intake of caffeine and increase fluid intake is not related to this question. Let us go to the next question. A client with hypovolemic shock to be ideally changed to which position? Option 1 supine position, option 2 left lateral position, option 3 right lateral position, and option 4 is Trendelenburg position. The right answer here is Trendelenburg position. Trendelenburg position, a variation of supine in which the head of the bed is tilted down such that the pubic symphysis is the highest point of the trunk. Facilitate venous return. So, indications of this position include pelvic surgery, central venous catheter placement, hypotension, which is already mentioned in our question, venous air embolism, reducing reflex, improving cerebral blood flow. All those conditions are indications for Trendelenburg position, head down position. Next question. A patient has a right knee arthroplasty 2 days ago and the patient refused to get out of the bed and ambulate due to chest pain. Which of the following action would the nurse most likely to implement? So here the patient is with chest pain or surgically. The options are 1. Medicate the patient prior to ambulation. Second option, add a nursing diagnosis of non-compliance. Option 3, let the patient rest now and then try to ambulate later. The fourth one is assess to determine the cause of chest pain. Let us go to the right answer. The right answer is assess to determine the cause of chest pain. Here it is an application level question where we have to find the priorities which will lead us to log the most appropriate answer. Here the patient is already with chest pain and he is not cooperating with the ambulation strategies because of that. So first we have to determine what is the cause of chest pain. If it is a myocardial infarction or ACS, coronary syndrome, it is top priority and it should be addressed immediately to prevent the life-threatening conditions and treat it. Medicate the patient prior to ambulation like analgesia and all should be considered if the chest pain is not of myocardial or coronary related. Non-compliance is a nursing diagnosis, but that is not a priority in this condition. Let the patient rest now and try to ambulate later is also not a solution for finding out the real cause of chest pain. So, the option 4 is the right answer. Next question. Pyridoxine is otherwise known as option 1 vitamin B12, option 2 vitamin B12, option 3 vitamin K, and option 4 is vitamin B6. Let us see the right answer. The right answer here is option 4 vitamin B6. Here the chart of vitamin B complexes: B1 thiamine, B2 riboflavin, B3 niacin, B5 pantothenic acid, B6 pyridoxine, B7 biotin, B9 folate, and B12 is cobalamin. Here I have prepared a short memory trick or memory tip for you. The numbers for B complex vitamins are from B1 to B12. 1, 2, 3, 5, 6, 7, 9, 12. So these all are the B complexes. So B1 is thiamine. So 1T. B2 is riboflavin. B3 is niacin. 5 is pantothenic acid. 6 is pyridoxine. 7 is biotin. Then 9 is folic acid and 12 is cobalamin. So 1, 2, 3, 5, 6, 7, 9, 12. TRNPPBFC. TRNPPBFC. This is the short form of the first letters of B complexes and the numbers. So remember this picture for your PC memory in exam halls for this questions related to vitamin B complexes. Next question. A patient after pacemaker placement suddenly starts complaining of chest pain. Patient is with dyspnea, cyanosis, and absent blood sounds on right side. What could be the diagnosis? Option 1 is cardiac tamponade. Option 2 is perforation of the heart. Option 3 is pneumothorax, and option 4 is hemorrhage. Let us go to the right answer. The right answer here is option 3 pneumothorax. Signs and symptoms of pneumothorax include sudden sharp stabbing chest pain, shortness of breath or dyspnea, rapid heart rate or tachycardia, and decreased breath sounds on the affected side. See this, you can see here, this is the affected side, and here the lung cannot expand properly due to the compression from pneumothorax or tension. So here the affected side will be having decreased breath sounds. So these classical signs are indicating the patient is most probably pneumothorax. Next question. What immunization is given at birth? Option 1 BCG. Option 2 hepatitis A. Option 3 DPT, and option 4 is MMR. Let us find out the right answer. The right answer here is option 1 BCG. In India, newborns typically receive BCG for tuberculosis, hepatitis B for hepatitis B virus, and oral polio vaccine for polio as the first immunization at birth. So BCG, OPV, and hepatitis D are the vaccines which is given at birth in India. Next question. The following manifestations are commonly associated with fever except. Except is a keyword, negative word. Be careful about this. Option 1 is headache. Option 2 is pinkish and red skin color. Option 3 is bradycardia, and option 4 is convulsions in infants and child. So which one is not a sign of fever? Let us go to the right answer. The right answer is bradycardia. See here the key word here is except. So you have to find out which is not a sign and symptom of fever. Headache can be a sign and symptom of fever. Pinkish and red skin color can be there. Bradycardia cannot be there. Most commonly, tachycardia will be associated with the fever or infection. Then convulsions in infants and child can also be seen in fever. So bradycardia is the raw option here that should be selected. Next question. Nosocomial infection is the type of infection which is first one, infection from an animal source. Option 2, infection from mosquito bite. Option 3, infection occurred from home. And option 4 is infection occurred from the hospital. So nosocomial infection. Let us see the right answer. The right answer is infections acquired from the hospital. Nosocomial infection, also known as healthcare associated infection, HAIs, or hospital acquired infections. So these all are the terms for nosocomial infections, which are infections that the patient occur while receiving medical care in a healthcare settings, such as a hospital. Examples or types of infections: central line associated bloodstream infections, CLABSI. Catheter associated urinary tract infections, COTI. Surgical site infections, SSI. Ventilator associated pneumonia or VAP. All those conditions or infections are examples of nosocomial infection or hospital acquired infections. Next question. A patient has had a hepatitis B and now a chronic carrier. In planning care, the nurse would explain an HBV carrier would most likely be at the risk for developing a super infection with which of the other type of hepatitis? Option 1A, option 2B, option 3C, and option 4 is D. Let us log the answer and let us go to the right option. The right answer here is option 4, hepatitis D. Hepatitis B and hepatitis D. Hepatitis B virus, HDV, is a virus that requires hepatitis B virus HBV for its replication. Hepatitis D virus affects globally nearly 5% of the people who have a chronic infection with hepatitis B virus. Hepatitis D virus infection occurs when people become infected with both hepatitis B and D simultaneously, that is co-infection, or get hepatitis D after the first being infected with hepatitis B, that is superinfection. Next question. The most suitable position among below for giving an enema is option 1, lithotomy position, option 2, right lateral position, option 3, prone position, and option 4 is left lateral position. Let us go to the right answer. This is most repeated question. So straight away we'll go to the right answer. The right answer is left lateral position. Left lateral or Sims position. The patient lies on their left side with the right leg bent at hip and knee is used for viewing enema. Next question. Chief complaints should be recorded using option 1, nurse's words, option 2, patient's words, option 3, physician's words, or option 4, bystander's words. Let us go to the right answer. The right answer is option 2, patient's words. The chief complaint should be recorded using the patient's own words to accurately reflect their symptoms and concerns. Recording the chief complaint in the patient's own word ensure that the healthcare provider understands the patient's perspective and symptoms without the influence of medical jargon or other potentially biasing information. Next question. Fear of death is a type of phobia which is known as option 1, thanatophobia, option 2, claustrophobia, option 3, acrophobia, and option 4, thalassophobia. Let us see the right answer. The right answer here is option 1, thanatophobia. Phobias related to the given options. Thanatophobia is fear of death. Claustrophobia is fear of closed space. Acrophobia is fear of height, and thalassophobia is fear of sea travel or large water bodies. Next question. A man has ingested an entire bottle of acetaminophen. Which of the following organ is affected? Option 1 liver, option 2 bile, option 3 kidneys, and option 4 is gallbladder. Let us see the right answer. The right answer is option 1 liver. Acetaminophen in overdose can seriously damage the liver. Next question. Which is an affective disorder among below? Option 1 phobic anxiety disorder, option 2 bipolar disorder, option 3 somatoform disorder, and option 4 is schizophrenia. Let us see the right answer. The right answer here is option 2 bipolar disorder. An affective disorder, also known as mood disorder, is a mental health condition characterized by significant disturbances in mood. So, affective disorder is always related to the disturbances in mood. Examples of affective disorders are major depression, MDD, bipolar disorders, PPD, and seasonal affective disorder, SAD. Next question. To examine the ear canal of a child, this is done by option 1, pull the ear down and back, option 2, pull the ear up and back, option 3, pull the ear only back, and option 4 is do not pull the ear, directly examine by otoscope. Let us see the right answer. The right answer here is pull the ear down and back. To examine an adult's ear canal, pull the ear up and back. And to examine a child's ear canal, pull the ear down and back. Next question. The first active fetal movement perceived by the mother is known as option 1 internal development, option 2 lightening, option 3 engagement, and option 4 is quickening. Let us see the right answer. The right answer is option 4 quickening. Quickening is when a pregnant woman first feels the movement of her fetus in uterus. Internal development, a sharp upward pushing against the uterine wall with a finger inserted into the vagina for diagnosing pregnancy by feeling the return impact of the displaced fetus. That is internal development. So it is a feel by the physician. So quickening is the feel by the pregnant woman, and internal development is the feel by the examining person. Lightening is when a baby drops into the pelvis during pregnancy. It can also be called engagement or baby dropping. So lightening and engagement is same. The other word is baby dropping. You can see the picture here. The baby in the second picture is already dropping into the pelvis. That is engagement or lightening or baby dropping. Next question. Hepatitis A is mainly transmitted via option 1 blood contact, option 2 food, option 3 sexual activity, and option 4 is saliva. Let us see the right answer. The right answer is option 2 food. Let us see the chart of viral hepatitis, their sources and route of transmission. Hepatitis A sources are feces and route of transmission is fecal oral route. So through the contaminated food. Then B, C, D all are similar. You can see here. B also blood derived body fluids are the source. C also the same, and D also blood derived body fluids. So similar sources and similar route of transmission also for B to D, that is percutaneous or permucosal mode of transmission. So you can see here. Then A and E, the sources are same, feces, and route of transmission is fecal oral for A and E. Let us go to the next question. The eye structure which receives stimuli and sends to the brain is option 1 retina, option 2 sclera, option 3 lens, and option 4 is iris. Let us go to the right answer. The right answer is option 1 retina. Retina converts light into nerve signals, where sclera, it is the white of the eye, support, protect and anchor the eye structure. Here it is sclera, you can see here. Lens will focus the light into the cornea, to the retina. Iris, it controls the amount of light that enters the eye by adjusting the size of pupil. So different functions here we can see once again. Retina converts light into nerve signals. Sclera, which is the white of eye, it will support and protect the eye structure. Lens will focus light into the retina, and iris will control the amount of light that enters the eye by adjusting the size of pupil. Next question. A child in post-ictal state of a seizure should show which of the following signs of symptoms? Option 1, feeling sleepy or exhausted. Option 2, stiffness over entire body. Option 3, verbalize having an aura. And option 4, eyes fixed in one position. Let us see the right answer. The right answer is feeling sleepy or exhausted. So, the post-ictal phase is the period after a seizure during which the body recovers and may experience temporary symptoms like confusion, drowsiness, fatigue, lasting from minutes to hours. Next question. The causative organism for chickenpox is option 1, adenovirus, option 2, varicella virus, option 3, SV40 virus, and option 4 is bacteriophage T2. Let us look the right answer. The right answer is option 2, varicella virus. Chickenpox is caused by the varicella zoster virus, VZV, a member of the herpes virus family. Next question. Prior to initiating therapy with unfractionated heparin for a patient hospitalized with deep vein thrombosis, this treatment requires option 1, bed rest, option 2, aspirin therapy, option 3, food restriction, and option 4, a high protein diet. Let us see the right answer. The right answer is option 2, aspirin therapy. The DVT treatment include anticoagulants or blood thinners, which include heparin, warfarin or coumadin, that is the oral. Then direct oral anticoagulants like DOACs, apixaban and dabigatran. Then compression stockings elevate the affected leg. Regular exercise like walking. Stay hydrated. Avoid prolonged sitting or standing. Quit smoking. Maintain a healthy weight. These all are the management strategies for DVT. Next question. Which of the following is a normal respiratory rate of a newborn? Option 1, 20 to 30. Option 2, 10 to 16. Option 3, 60 to 100. And option 4 is 40 to 60. Let us see the right answer. The right answer is option 4, 40 to 60. Infants, that is 0 to 1 year, 30 to 60 breaths per minute. Children, that is 1 to 6 year, 20 to 40 breaths per minute. Then children 6 to 12 years, 14 to 30 breaths per minute, and adults 18 plus years will be having 12 to 20 breaths per minute as a normal respiratory rate. Then bradypnea, a respiratory rate below 12, and tachypnea, a respiratory rate above 20 in case of adults. Next question. Autoclaving is an example of option 1, moist heat, option 2, dry heat, option 3, biological agents, and option 4 is chemical agents. Let us go to the right answer. The right answer is option 1, moist heat. Autoclaving is a sterilization method that uses pressurized steam to kill microorganisms. So, steam is a moist heat. Moist heat and temperature between 121 degree and 134 degrees Celsius, and pressure is 5 to 15 psi. Next question. The visual examination of the cervix and vagina by special instruments is called as option 1 colposcopy, option 2 hysteroscopy, option 3 proctoscopy, and option 4 is salpingoscopy. Let us go to the right answer. The right answer here is option 1 colposcopy. Scopy is the visual examination of the internal organs. So here you can see the given options and related scopies. Colposcopy is the examination of cervix and vagina. Hysteroscopy is for uterus and cervix. Proctoscopy for rectum and anus, and salpingoscopy is for fallopian tube. Colpo for cervix, CC. Hystero for uterus. Procto for rectum and anus. Salpingo for fallopian tubes. Last question of this part. The diagnostic statement should include option 1 etiology, vital signs and prescription, option 2 problem, etiology and prescription, option 3 problem, etiology, signs and symptoms, and last option is option 4 etiology, signs and symptoms and medications. Let us see the right answer. The right answer here is option 3 problem, etiology and signs and symptoms. A diagnostic statement often formatted as PES, problem, etiology, symptoms. So remember this short code for diagnostic statement for a nursing diagnosis, that is PES, problem, etiology, symptoms. A diagnostic statement, particularly in a nursing context, should include the problem or nursing diagnosis, the etiology or underlying cause, and the sign and symptoms or defining characteristics. So PES. So we are winding up this session. Thank you all for watching this video, and please like, share and comment for your opinions, and wait for the next portion. Thank you so much.